You pay hundreds of dollars a month for health insurance, you barely go to the doctor, you try to do everything right, and then the price still goes up next year. It feels like a penalty for being healthy. And it's not just you. In this video, I'm counting down 12 real reasons health insurance in America keeps rising even when you don't use it, and what you can do about each one. By the end, you'll know where the money really goes, what parts of the system push prices up, and how to protect your wallet without guessing. Number 12 is a big driver. Medical bills often include separate charges you didn't even know existed. A classic example is a facility fee. You might go to a clinic that looks like a normal doctor's office, but it's owned by a hospital system, and suddenly the bill has an extra charge just for using the facility. Or you get a simple test, and the bill is split into the professional part and the technical part. Or the lab work is billed separately from the visit. These layers make the total cost higher, and when the total cost rises, premiums follow. You can feel like you're barely using healthcare, but one visit can create multiple claims. That pushes spending up for the whole pool. What can you do? Ask one simple question before non-urgent care. Will there be a facility fee or separate billing? It feels awkward, but it can save you money. Also ask, is this done in a hospital setting or an outpatient clinic? The same service can cost very different amounts in different places. Next is 11, and it's controversial but real. Healthcare markets in many places don't act like competitive markets. In plain English, when one big hospital system buys up smaller clinics and practices, you may end up with fewer choices. Fewer choices often means higher prices. In many towns, there aren't 10 hospitals fighting for your business. There might be one or two. And because most people follow the doctors they already know, big systems can gain power without you noticing. When a system has more power, it can push for higher payments in negotiations with insurers. Those higher payments show up later as higher premiums. The frustrating part is you don't see this directly. You see it as my premium went up again. What can you do? During open enrollment, don't just look at the monthly premium. Check the network. If your plan has a wider network with more options, it can sometimes give you access to lower-priced providers. If your area only has a few systems, a plan that steers you to the best value providers can matter. Also, if you can choose between locations for a scheduled procedure, compare the sites. Same procedure does not always mean same total price. Now number 10. Prescription drugs and pharmacy pricing are a huge part of why costs rise, even if you personally don't take many meds. This one is a maze, but here's the simple version. A lot of modern drugs are amazing and life-changing, and they can also be very expensive. There are also layers of middle steps in how drug prices get set and paid. Discounts, rebates, formularies, tier lists, preferred drugs, prior approval rules. Most people never see the real price. They only see a copay. But the plan still pays the larger cost in the background. If drug spending rises for the pool, premiums rise. And here's the part people miss. Even if you personally don't use prescriptions, other people in your pool do. And drug costs can grow faster than other parts of healthcare because new drugs keep arriving and some are priced high. What can you do? If you do take meds, ask about generics or lower-cost options when appropriate. Ask if there's a different version in the same class that's on a better tier. If you don't take meds, you still benefit from learning this because you'll need it someday, and because it helps you choose a plan that covers your future needs without surprise costs. High-cost care is concentrated in a small number of patients, and it only takes a few big cases to move the price for everyone. This isn't a moral point, it's just how the numbers work. Most years, most people don't have giant medical bills, but a small number of people have extremely high costs. Serious accidents, premature births that need long hospital stays, complex surgeries, cancer care, organ failure, intensive care. Those events are rare compared to everyday doctor visits, but they're expensive enough to dominate total spending. If those big case costs rise even a little, the whole pool price can rise, and premiums follow. This is why I never use it doesn't protect you from increases. You're in a pool where the cost is driven by the largest claims, not the average checkup. What can you do? Understand your out-of-pocket maximum. That number matters more than most people realize. If the worst happens, that's your ceiling for in-network covered care. A plan that looks expensive monthly might actually protect you better in a crisis. Also, build a basic emergency buffer if you can, even a small one, because high-deductible plans can hit hard at the wrong time. Now number 8. the insurance part has grown beyond pure insurance. Many plans are expected to manage health, prevent illness, coordinate care, run nurse lines, manage chronic conditions, and negotiate complex networks. Some of that helps, some of it adds cost, but even when it helps, it still takes staff, systems, and contracts. People often imagine an insurance company as just a billing machine. In reality, the plan is running a giant operation, setting up networks, processing claims, handling appeals, fighting fraud, managing customer service, building tech systems, meeting regulations, reporting data, and trying to predict next year's spending. That infrastructure costs money, and it can grow when the healthcare system gets more complex. What can you do? Use the resources you already pay for. If your plan offers a nurse line, a virtual visit option, or care navigation, try it once. Not because it's perfect, but because it can steer you away from expensive care pathways when your issue is simple. It can also help you find in-network options faster, which matters more than people think. Next is 7. The way providers get paid can reward more volume, more codes, and more complexity. This is one of those incentives topics that can make people angry, but you don't have to blame anyone to understand it. In many parts of healthcare, payment is tied to doing things: visits, tests, procedures, separate services. When payment is tied to quantity, the system naturally produces more quantity, not always for bad reasons. Sometimes it's because new guidelines say to screen more. Sometimes it's because technology makes it easier to test. Sometimes it's because the patient wants certainty and the provider wants to be safe. But more services usually means more cost. That cost rolls into premiums. What can you do? Learn to ask one calm question. What happens if we wait and watch? Not for emergencies, for non-urgent issues. Sometimes the best care is time and follow-up, not another test today. Also ask, will this change what we do? If a test result won't change treatment, it's worth pausing. You're not refusing care. You're demanding clarity. Number 6, defensive medicine and fear of missing something can push costs up. Again, no villain needed. In America, providers can feel pressure to document everything and order extra tests to reduce risk, both medical risk and legal risk. Patients also expect certainty. We want a clear answer now. But bodies don't always give clear answers on a schedule. Sometimes the system responds by ordering more imaging, more labs, more specialist visits. Many of those are helpful, some are not, but they all cost money, and the insurance pool pays. What can you do? Build a better relationship with your primary care provider if you can. When a provider knows your history, it can reduce unnecessary repeat testing. It can also reduce the just-in-case spiral because there's a baseline understanding. And if you don't have a regular provider, consider finding one, even if you only see them once a year. It's not a magic trick, but it can help. Now number 5, prices are often hidden, and hidden prices behave differently than visible prices. In most parts of life, you see the price and then decide. In healthcare, you often decide first and see the price later. That changes behavior. It also makes it harder for normal competition to work. If you can't compare costs, you can't reward the best value. And when there isn't a strong pushback, prices can rise. That doesn't mean every provider is greedy. It means the system allows price growth without friction. Your premium is downstream from that. What can you do? For scheduled care, request an estimate. If the office says, "We can't," ask who can. If the estimate is vague, ask for a range. If you get a bill that doesn't match what you were told, ask for an itemized bill and question it. You don't need to be rude. You just need to be persistent. A lot of billing mistakes get fixed only when a patient asks. Next is 4. Employer-based coverage can hide the true cost, which lets it rise quietly. Many people get insurance through work. Your employer may pay a big chunk of the premium, and you pay the rest. That sounds great, but it also makes the price less visible. If the premium rises, you might not see the full increase because it's split between your paycheck and the employer's budget. But here's the thing, employers don't have a magic money tree. When health costs rise, it can show up as smaller raises, slower hiring, higher worker contributions, or higher deductibles. It becomes part of the overall compensation trade-off. That's why people feel like they're paying more even when they don't use insurance. They're paying in multiple ways. What can you do? During open enrollment, compare total cost, not just premium. Look at deductible, copays, coinsurance, and out-of-pocket max. If you have choices, do a bad year scenario and a normal year scenario. Many people choose based on fear or habit. A quick math check can save you a lot. Cost shifting happens, and it's confusing. Here's a simple way to think about it. Healthcare providers get paid by different sources. Some payments are lower, some higher. When providers feel squeezed by one source, they may try to negotiate higher payments from another source. That can raise the prices that private insurance pays, then premiums rise. This is a hot debate topic, and the details vary by place, but the basic idea exists in many parts of the system. Money pressure in one area can push prices up in another. What can you do? This one is hard to fix as an individual, but you can protect yourself by understanding that premiums reflect the whole ecosystem, not your personal choices. That can help you stop blaming yourself for a system-level trend. Focus your energy on the parts you can control: plan selection, network use, and avoiding surprise billing. Now, number 2, the yearly reset is built to feel like a punishment. Most plans reset deductibles and out-of-pocket tracking every year. So you can be healthy, barely use care, and then the moment you finally need something, you start from zero again. Meanwhile, you've been paying premiums the whole time. That creates a strong emotional reaction. I paid all year and got nothing. But premiums pay for the risk protection, not just what you used. And the reset exists because plans are priced and regulated in annual cycles. It also makes plan accounting cleaner. But for regular people, it feels harsh. What can you do? Time non-urgent care when possible. If you've already met your deductible late in the year and you need a follow-up test or procedure, it may be cheaper to do it before the year ends. Don't rush medical decisions just for money, but if your doctor says timing is flexible, timing can matter. Also, if you have ongoing care needs, consider plans that have predictable copays for common services instead of making you hit a big deductible first. And finally, number 1, uncertainty is expensive, and the system prices uncertainty into your premium. Insurers don't know exactly who will get sick next year. Providers don't know exactly what new treatments will be available or what they will cost. Employers don't know exactly how many employees will have major claims. Families don't know what health surprises are coming. When everyone is uncertain, the price includes a cushion. Add in the fact that health plans often face rules that change, benefit requirements that shift, and markets that swing, and you get even more uncertainty. People hate hearing that because it feels like, so I pay more because nobody knows? Yes. In many ways, yes. That's what insurance is, paying now to reduce uncertainty later. And in America, where prices are high and hard to predict, that uncertainty cushion can be bigger. What can you do? Get practical. First, know your plan details before you need them. Deductible, out-of-pocket max, and what in-network really means. Second, build a small medical buffer if you can, even if it's modest. Third, use preventive care you're entitled to, because catching things early is usually cheaper than catching them late. And fourth, if you get a confusing bill, don't ignore it. Call, ask, appeal if needed. A lot of people overpay simply because they assume the bill is final. So here's the big picture recap. Health insurance keeps rising even if you never use it because you're not paying for your month-to-month care. You're paying for risk protection, shared costs, rising medical prices, complex billing, expensive drugs and treatments, and a system where prices are often hard to see and hard to challenge. Your personal doctor visits are only a small part of what drives the premium. The good news is, you still have moves. Choose plans based on worst-case protection and total yearly cost. Stay in-network. Ask for estimates. Watch for surprise fees. Understand your out-of-pocket max. And question bills that don't make sense. If this helped you understand what's really going on, hit like so more people can find it. And I want to hear from you. What's the one part of health insurance that confuses you the most? Deductibles, networks, drug coverage, or billing? Comment that below. And tell me if you're on a work plan or you buy your own plan, because the advice can be different. And if you know someone who's healthy and still paying more every year, share this with them.